Hi, I'm Dr. Rosina Badan Munir. I'm an ultrasound specialist and educator. I'm presenting a brief video of COVID 19 lung ultrasound. Those who are not familiar with the lung ultrasound, this brief video training will be enough for them to evaluate and monitor their patient of COVID 19. X rays and CTs are the more traditional modes of imaging and the mode of choice to estimate the pulmonary damage in patients with COVID 19. But there are some limitations as these equipments are not always available in emergency setting. Another main issue is that in COVID 19, whether it is a confirmed case or it is a PUI, patient under investigation, the traditional imaging means that you have to shut down the room where the exam is performed for a disinfection to get it ready for the next patient use. Now, this practice is not affordable in a busy setup. Patient conditions such as hypoxemia and hemodynamically instability is also a challenge in performing such exams. And also, radiations and the time consumptions are some of the other factors in performing the CTs and the X rays. As an alternative mode, bedside lung ultrasound plays a promising role to assess the patients in acute respiratory failure. The ultrasound plays an important role in assessing the lung conditions such as pulmonary edema, pneumonia, collapse, effusions, pneumothorax, and hemothorax, and its efficacy is shown over more than a decade all over the world. The benefits of ultrasound are its safety, repetition of the exam, non radiation, low cost, portability, and the point of care study. In COVID 19, the traditional card based system also has some challenges in entire system disinfection until and unless you have a proper disposable protective sheet for the complete system. In current emergency situation, the handheld ultrasound device plays a major role. The entire system can be placed in a protective sheath, which makes it easier to disinfect the device. And you can also have a dedicated unit or a smartphone or iPad for COVID 19 patients in any standard disposable protective sheet. Now, this allows you to monitor or evaluate the patients of COVID 19 in tents or outside of the hospital where other imaging modalities are not available. The handheld units such as Sonon from the Health Sirion plays a very valuable role in the COVID 19 pandemic because of its compact size, wireless connectivity, high quality imaging, which can be easily and securely transferred to any storage system. Now we will learn how to scan. We use two kinds of probes, whether the curved probe, which has a curved footprint, or we can also use the linear probe, which has a linear footprint. So both of these probes can be used for the evaluation of the lung ultrasound. Now we will perform the 12 zone examination method. In this you will draw the imaginary lines, the parasternal line, the anterior axillary line, and the posterior axillary line. This will divide the chest wall into anterior, lateral, and posterior regions on both right and left side. Now, if you draw an imaginary line, imaginary horizontal line, so you will divide the anterior zone into upper and lower zones, and the on the upper side, the superiorly it is delineated by the clavicle, and inferiorly by the liver on the right side, and the spleen on the left lower side. Similarly, the lateral side is again by a horizontal imaginary line. It is divided into upper lobe, which is more towards the axilla, and then the lower lobe. On the posterior side, again, the horizontal imaginary line will divide the lobes into upper and the lower lobes. So altogether, the anterior, lateral, and posterior, it is divided into 12 zones. The ultrasound probe is placed longitudinal and perpendicular to the ribs over the intercostal space using the ultrasound gel. The transducer marker is pointing towards the patient head in the longitudinal plane. Now move the probe along the direction of the arrows as shown over here. So you move the probe up and down and then from side to side to check the whole region. Predominantly, the bilateral posterior lung zones are more diseased, and it can be seen from the back. Inferior lung zones are the other common sites which are diseased. In order to evaluate the patient for the lung pathology, it is important to recognize the normal sonoanatomy of the lungs. So if you look at over here, when you put the probe on the patient chest in a longitudinal plane, the ultrasound beam travels through the skin. It travels through the skin, it passes through the subcutaneous tissue, and then it strikes the rib and the pleura. So at the soft tissue and rib interface, you will see an echogenic or the bright white line. So if you look at over here, this white bright line, this is also over here. So this is the bone. So which means that the total reflection of the sound waves take place and no more sound passes through the rib, so that this rib will appear as bright white line, and behind the rib you will see the posterior acoustic shadowing. So that's how you will recognize the rib on the ultrasound. So now what happens when the sound waves passes through the soft tissue and it comes at the visceral pleural and the lung air interface, greater than 99% of the ultrasound beam is reflected back towards the transducer, and no sound wave passes through the air. So this structure, so if you see over here, this structure, the pleura, will appear as again bright line, and behind this is the lung area, and you will not see any structure. This is all what you see is the reverberation artifacts, because the lung is filled with air, and so the sound waves does not passes through the air. So this thin line, this thin bright line, this is the visceral and parietal pleural interface, and this you will see that this line will move during the respiration, and this is called the sliding sign, where you see the movement of the pleura. Actually, it is the visceral and parietal pleural sliding. And this line is thin white line is the pleural line, and it is not greater than 2 millimeter. So I'm sure now you recognize that the bright or white line, which is called in the ultrasound, this is called the hyperechoic line or echogenic line. So this hyperechoic line or the bright line, where you see the black shadow behind it, it is the rib. But the in between the rib, the bright line, which is moving, so this is the pleura, and behind that you will see the reverberation. All these are the reverberation artifacts. Now these reverberation artifacts has also a very importance in the evaluation of the lung disease, which we'll talk in a few minutes. In some textbook, this appearance of the black rib, the rib area with the black shadow behind it, posterior to it, and the pleural line. In some of the textbook, this sign is called the bat sign. But I would just say, remember that the pleural line and the rib shadow and the movement of the pleural line in this between the two ribs and the thickening of the, just keep in mind that the pleural line is regular, smooth, and it is thin. Now, if you look at over here in this image, you see a very thin, bright white vertical line, and you see that it is more symmetrical and it extends all the way to the end, and it is not spreading out. So this kind of thin white line is called the focal B line. And this is also called a comet tail line, and this focal B line or the comet tail line has a very important role because it helps you to identify that this is a normal lung. Because when you examine the area, such as between the two ribs, in that area you just see one, or even you don't see this comet tail white line, which is regular and smooth, and it is goes straight all the way to the bottom of the screen. So this is the normal focal line, and in one zone there may be one or two focal B lines which are normal in a normal lung. Now if you look at this slide, so you will see that this is the pleural line, and then we will see the multiple horizontal lines, and these are parallel and equidistant from the pleural line. So these horizontal lines are called the A lines, and this is a reverberation artifact which is also seen in a normal lung. Now if you look at over here, this image which is taken with a linear probe, and this image which is taken with a curved probe. So you can see both the lung in both images, but it is more clear on the with the linear probe. So now we learn from this slides that you will look at the normal lung, where you will identify the bad sign, which is the ribs and the pleural line in between. So this appearance of the normal lung with the comet tail. If you don't see the comet tail, sometimes you will see very small tiny comet tail close to the pleural line. So but you will also notice the sliding sign. So this is the normal lung, and if you look at, and you will find these horizontal lines, you will see the horizontal lines on the curved the linear probe is also present over here. And so the presence of A lines, presence of normal, smooth, thin B lines, and the sliding sign, these are the few things which you have to remember when you are scanning the lung and evaluating the patient for any pathology. Now this is the video where you will see the movement of the visceral pleura over the parietal pleura, and this produces the sliding sign during the respiration in the lung. You will also notice a comet tail artifact. As you will see only one comet tail artifact, and you notice the sliding movement. There are small little comet artifacts over here also, and these are the A lines. And this bright line is the rib, and behind that is the acoustic posterior shadowing, the pleura, and this is the soft tissue. Now we will learn the patterns of lung ultrasound in COVID-19 patient. There are 5 characteristic findings useful to evaluate the critically ill COVID-19 patients. Number 1 is the pleural line thickening and the pleural line irregularity. Now if you look at over here, this is the normal lung, and you see if you measure this thin pleural line, it is not more than 2 millimeter. But when you look at the pleural lining of the COVID-19 patient, so you will see that the pleural lining is very irregular. Just see the thin smooth line, pleural line on a normal lung, and look at over here, even with the eyeball evaluation, you will see that it is very irregular, and it seems to be thickened also. So this exam is done with the curved probe, so you can see the rib over here, and the acoustic posterior shadowing over here. This is also the rib and shadow, but this is the normal and this is the abnormal. So you notice over here the irregular and thickened pleura in a COVID-19 patient. Now another sign which you will see in a COVID-19 patient is the presence of higher proportion of B lines in a variety of patterns, including the focal B line. So look at over here, this is the focal B line in a patient, and you also see the multifocal fused homogeneously or the diffuse pattern of the B lines. And this is these lines are now greater than 3 or more, so these lines are fused together, and this indicates the interstitial lung disease as the disease progresses. So this line spread throughout the scan. If you look at over here, these lines are spreading all the way towards the bottom of the screen, and they are spreading. And if you look at over here, this is the normal lung and the normal B line, and now you can identify in that this is one focal B line, but it spreads all the way to the bottom. And over here, as the disease progresses, you see the diffuse pattern of the B lines. So all this indicates the advanced interstitial disease of the patient suffering from the COVID-19. Now, with progression of the disease, variety of subpleural consolidation patterns are also seen, which is consistent for focal pneumonia. So you will see that the pleural line. So this is the pleural line, and you will see the diffuse B line. So you see over here, and you will also see this diffuse B lines indicates the sign of inflammation. And if you look at over here, you will see the B line is discontinued over here. So this shows you the sign of consolidation. So you see over here, the pleura is fine here, and you will see this rib shadow. The pleural line is okay, and then now you will see a big irregularity over here, and this is the consolidation with a lot of white area behind it. So this shows the sign of consolidation, which is consistent with the pneumonia. So this is the normal lung, and this is the patient suffering from the COVID-19, which is which shows the diffuse inflammatory disease, and now the sign of consolidation and the pneumonia. Now, if you see over here, sometimes in the consolidated lung, you will see the tissue-like appearance with these small, thin, static or dynamic white structures, which are the air bronchograms. Presence of these air bronchograms is associated with the severe progressive disease and severe pneumonia. So this is another sign which you should keep in your mind, that if in a consolidated area, if you see these echogenic structures, so this is consistent with the severe pneumonia. The skip lesions is another characteristic finding which you will see in the COVID-19 patients. It means that you see the segments of lung thickening and the irregular lung pleural lining. Then you will see the normal lung lining or the normal pleura, and then you will see some other pathologies such as the consolidation. So instead of getting the entire diseased lining, you will see different segmental findings. In some cases of COVID-19, the development of pleural effusion is with the collapsed lung is also seen. And for that, you can just evaluate your patient by putting the ultrasound probe subcostal region, and then using the liver or the spleen on the left side and right side the liver as an acoustic window, and then you will look at the diaphragm. So look at the diaphragm, and if there is a presence of pleural effusion, you will see the fluid as anechoic, as a black area. So if you look at over here, this is the normal liver, this is the echogenic diaphragm, and this is the lung area. So in a normal case, you will see the liver appearance of the liver above the diaphragm. This sign is called the mirror sign, where this is the actual liver, and the diaphragm will act as a highly refractive surface, and so you will see the liver above the diaphragm also. So when the mirror sign is absent, and you see the anechoic area, so this is the diaphragm, and you see all this black area, so this is the presence of the fluid, and this is the pleural effusion. If you look at over here, this is the liver, and this is the diaphragm, and then you see this black area, and this is the consolidated lung. So this is the consolidated lung with the pleural effusion. There's another sign which is called the spine sign. So if you look at over here, in a normal patient, you will not see the spine extending all the way towards the lung. You will see the spine only up to the end of the liver. But in case where the pleural effusion is present, you will see the extension of the spine all the way towards the lung. So the presence of the spine sign and the absence of the mirror sign and the presence of the anechoic area, so all this means that the patient has pleural effusion. Now, these were all the findings which we see in the COVID 19 patient. But when the patient is in a recovery phase, so you will see the presence of the A lines bilaterally, and this proves you that the patient is now in a recovery phase. And you will also see the normal sliding sign and the normal B lines. Now, there are some tips for the scanning. So, there are two very important things which you have to keep in mind when you are scanning. One is the depth. So, if you look at over here, that the appropriate depth is very important when you are scanning and you are looking for any pathology. So, if you look at over here, the depth is very high. So, at this level you are not even, yes, you can see the comet tail sign very nicely, but you're not able to see the pleural evaluation of the pleural line over here. But when you will decrease the depth, you can very nicely evaluate the changes in the pleural line, whether it's a whether sliding sign is present, or whether there is any irregularity in the pleural lining, or there is any other changes in the pleural line. So the appropriate depth is a very important step that you have to keep in your mind when you are scanning. Another important thing which you keep in your mind is the proper gain. The use of proper gain is very important. So if you look at over here, this image shows very low gain that you cannot even identify, and you cannot evaluate the structures over here. In this image, the gain is too high, is also not even possible to evaluate, to make any evaluation. But you select the appropriate gain, so you can see the normal anatomy of the structures. These are some of the references which are used for the preparation of this video, and thank you so much.